So we know that androgen deprivation therapy is associated with a cluster of side effects that can cause metabolic syndrome development. And NCCN, ACS, and other guidelines have recommended to screen for those who try to prevent metabolic syndrome development in our patients who are receiving androgen deprivation therapy. So what we did is we looked at the data between 2010 through 2021. 2010 was when those guidelines came out with the recommendations, and we looked into patients who received androgen deprivation therapy and whether they got any screening for the risk factors for metabolic syndrome, including blood pressure check, lipid check, glucose check in those patients. Our state, New Mexico, is a minority-majority state, and this state the population includes around 49% Hispanics and 11% American Indians. So we are a majority-minority state, and we also were interested in looking into the disparities between those risk groups. And so what we found was overall the rate of screening was low. Only around 25% of the patients who received androgen deprivation therapy underwent screening for metabolic syndrome risk factors. And when we looked at the different race groups, we found that there was a statistically significant difference across all the races. When we looked at the treatment for metabolic syndrome, there was no significant differences there. So the strength of our study is this is the first study that is looking into all the risk factors for metabolic syndrome, not only the cardiovascular ones. The previous studies have only looked at cardiovascular outcomes. And the second strength of our study is that we are again the first data that's reported on the racial disparities in screening and treatment for metabolic syndrome in patients who receive ADT. Our limitations is this is a single institutional study, retrospective based on the EMR, so by nature it has limitations of those. We had to rely on whatever was documented in the EMR, and we had to exclude patients whom were not getting their primary care treatment in our system, outside of our system, just because there was no way that we could track risk factor screening in those patients. So those are the limitations of our study. We think that this study can open a lot of hypothesis generating and can open options for further study. We thought of recommendations such as maybe integrating the blood work, the lab work for screening for metabolic syndrome in the ADT orders. So patients who come to get their treatment, they can also have a pop-up on their labs and have labs run other than PSA. Or maybe there can be a pop-up for reminding the provider to check those or refer to a primary care physician to check for those to take the burden off of the oncologist treating patients.